Okay, we start with the comfort. When we talk about pain, sa pain muna tayo. Okay, pain is a highly unpleasant and very personal sensation that cannot be shared with others. Kasi di ba ang pain natin, ikaw lang naman nakakaramdam dyan, gaano ka siya kasakit. For example, gaano siya, how will you rate that one? Okay? One of the most complex human experiences, ibig sabihin dito, it is an infinite amount of event or emotion and situation and difficult to define. Okay? An individual phenomenon influenced by the interaction of affective. Affective is any interaction that is colored by an emotional experiences and also behavioral, cognitive, and the physiologic sensory factors. Okay? And when we talk about the nociceptors, nociceptors is a sensory pain receptors that are free nerve endings in the tissue that respond to the tissue injuring stimuli or what we call the noxious stimuli. Okay, receptors that respond to noxious temperature and also uh, noxious temperature changes or what we call the thermoreceptors. Thermoreceptors, it is able to detect the differences in temperature. Okay, kung sobrang init, okay yan, madedetect yan ng katawan mo, which is, i-respond yan papunta sa brain, which kaya siya magsasabihin dun sa extremity mo, ay mainit, tanggalin ko yung kamay ko sa pagkakahawak. Okay? Another one is the chemicals. Sa chemicals is the chemoreceptor. Chemoreceptors is special nerve cells that detect changes in the chemical composition of the blood and sends information to the brain to regulate cardiovascular and also respiratory functions. Okay, or pressures or what we call the mechanical receptors. For this one, it converts the mechanical pressure into electrical signals, okay, which transmit the pain if the noxious stimuli are sufficiently strong. Okay, found in the skin, saan pa? Sa mga blood vessels, subcutaneous tissues, muscles, fascia. When we talk about the fascia, this is a connective tissue that holds every organ, okay, and also blood vessels, bone, nerve fiber, and also sa mga muscles in place. Okay, and also the periosteum, sorry. The periosteum is a connective tissue covering most of the bones. Okay, we have also the viscera, joints, and other structures. So, dun sila nakikita, yung mga nociceptors natin. Okay, nociceptors are located on two types of the peripheral nerve cells that are responsible for transmitting pain from the tissues to the central nervous system. So, we have the two types of peripheral nerve cells. We have the A delta cells or the alpha, okay, and also the C fibers. For the A delta fibers, it gave rise to the bright, sharp, localized pain that is immediately associated with the injury. Okay, ito yung pinaka-first pain na mararamdaman. Okay, after that one, the C fibers cause a second pain sensation that is dull, okay, poorly localized, and also persistent after the injury. Okay, we have also our regions and causes of pain. We have the cutaneous pain. Cutaneous pain originates in the skin or the subcutaneous tissue. Example, if kapag na paper cut yung kamay mo, kaya siya nagkakos ng sharp pain. Okay? Next one is the deep somatic pain, arises from the ligaments, tendons, bones, blood vessels, and also the nerve. It is diffuse and tends to last longer than the cutaneous pain. Example, kapag nagkaroon ka ng ankle sprain. Kapag sinabi natin sprain kasi, this is overstretching or tear of the muscle. Okay? This is a uh, strong ligament that support the ankle. Okay? So, yun, yung ano niya, difference ng ating deep somatic pain and also the cutaneous pain. Next one is the visceral pain. For the visceral pain, results from stimulation of pain receptors in the abdominal cavity. Aside from that one, the cranium, which is sa skull, and also sa thorax. Sa thorax natin, ito yung this is the space in the chest that contains the organs, blood vessels, and also nerves. Okay? It tends to appear diffuse and often feels like deep somatic pain that is burning, aching, or the feeling of pressure. We have an example here, the ischemia or the muscle spasm. Sa ischemia, this is kapag ka nagkakaroon ng decreased oxygenated blood flow, okay, restricted or reduced dun sa part ng sa part, one part of the body. Okay? And also for the muscle spasm, this is a forceful and involuntary contraction of the muscle. Okay, next one, we will be discussing about the types of pain. For the types of pain, we have the acute and then the chronic. Acute may have a sudden or a low onset. It varies from mild to severe. It may last up to 6 months and subsides as healing takes place. Okay, it reflects potential and also pwede siyang maging ma-present tissue damage. Okay, chronic pain, more than 6 months naman to. So, yun yung pagkakaiba ng ating acute and chronic. Pag sinabi nating acute, with less than 6 months, and then kapag chronic, more than or longer than 6 months. Okay? Often limits normal functioning. Usually, it increases at night, itong ating chronic pain. So, for the concepts associated with pain, we have the pain threshold. Okay? It is the amount of pain stimulation of a person requires in order to feel the pain. Okay? And also, this is the minimum intensity at which person begins to perceive or sense the pain. Okay? Ito yung stimulus as being painful. So, yun yung pain threshold. Okay, pain reaction, autonomic nervous system, which is siya yung nagkocontrol ng mga involuntary actions and behavioral response to pain. Okay? It protects the individual from further harm. Okay? Automatic withdrawal of hand from, for example, ito, automatic withdrawal of hand from hot stove. Pag once na nahawakan mo mainit, okay, tatanggalin na agad yan. Yan yung pinaka-reaction. Okay? Siya yung nag-send ng signal papunta sa brain, then magsasend din ng motor response na tanggalin mo na yung kamay mo dun sa hot stove. Okay? Pain tolerance. It is a maximum amount and duration of pain that an individual is willing to endure. Okay? Ano yung pain tolerance mo, kaano mo kakayanin. Okay? Influenced by psychological and socio-cultural factors and appears to increase with age. Okay? Dito sa ating socio-cultural factors, bakit kaya nagiging influence ang isang pain tolerance? Because it affect the perception and also yung experiences and then expression nila sa pain. Okay? Kapag sanay ka naman for example, ikaw yung taong sanay ka magtrabaho, yun, mas lalong tatagal yung or mas mahaba ang pain tolerance mo. Kaysa yung mga tao na walang ginagawa, okay? So, yung mas maano yung pain tolerance nila. Next one, sa ating pain assessment. For the pain assessment, accurate assessment focusing on pain's cause is essential for determining the proper therapy. The nurse must obtain a pain history, kung kailangan malaman, physical examination that focuses on the client's physiologic and also the behavioral responses to pain. Okay, data that should be obtained on pain history, we have the location, intensity, quality, pattern, precipitating factors, and also the alleviating factors. Okay, for the location, itatanungin natin, where is the pain located? Okay, tuturo naman niya yan. This can be measured objectively by using a drawing of a body outline para maituro niya kung saang part. Okay, intensity. What is the magnitude of or intensity level of the pain? Okay, we will be using the pain scale dito sa ating intensity. For example, sa adult natin, from score of 1 to 10, okay? Or 0 to 10. 0 is the lowest and 10 is the highest. Okay? Yun ang sasabihin natin. Doon na siya mag-i-scale kung gaano kasakit yung nararamdaman niyang pain. Okay, for the quality, descriptive adjective helps people to communicate the quality of pain. Example, sasabihin hammer-like, okay? Piercing like a knife. Para akong sinasaksak. Ganun po siya kasakit. Okay, quality, gaano niya i-describe yung pain na nararamdaman niya. Okay, pattern naman, it includes time of onset, okay, kailan nag-start, duration, gaano siya katagal, and gaano siya pabalik-balik, yung persistence or yung intervals niya without the pain. Ilang minutes bago ulit bumalik. Okay, ganun ang tatanungin natin sa pattern. When the pain began, onset, how long the pain lasts, gaano katagal yung pain na naramdaman nyo, sasabihin naman niya kung ilang minutes. If recurrent, the length of the interval without pain, ilang oras yung di ba yung onset niya tatanungin natin, and then biglang nawala. Tanungin natin ilang minutes yung onset or yung pagitan nung next na pain. Okay, when pain last occurred. kailan po huli mong naramdaman yung pain na yan. So, tatanungin lahat yung pattern. Okay, we also have the precipitating factors. Ano yung mga activities that sometimes proceed with the pain? Ano yung ginawa mo bago mo naramdaman yung pain? Ano yung kinain mo before mo naramdaman yung pain, mga ganon. Okay, ano nangyari bago lumabas yung pain? Bago mo siya naramdaman, ganon. Okay, for the alleviating factors naman, this include the analgesic taken, rest, and application of heat or cold. Tanungin natin, anong ginawa mo nung naramdaman mo yung pain? For example, sabi niya, nag-take lang ako ng pain reliever. So, tatanungin natin yon. Okay, ano yung nag-alleviate or nagpawala doon sa pain niya? Ano yung ginawa ng patient? Okay, this is the another example also of pain assessment using the PQRST. We have the P, which is the provoking factors. What factors precipitated the discomfort? What were they doing at the time of the onset? So, tatanungin yung last activity before nagkaroon ng pain. Okay, the quality, yung parang kanina lang din. Ask the patient to describe the pain or the discomfort and its characteristic. Gaano yung ano niya, gaano siya yung quality, yung pagka-describe niya. Okay? Region or the radiation, where is the pain? Saan siya part? Does it radiate? Lumilipat pa? Okay? Is there pain anywhere else? May iba pa bang area na masakit sa'yo aside from that one? Ganon. Okay? Severity, ask the patient to rate their pain or discomfort on a pain scale. Yun yung ano din natin kanina sa may sa may intensity kanina. Okay, for the time, how long has the patient had the pain? Does anything make it worse or better? Kung may ginawa ba or kung gagawa siya ng activity, mas lalong sasakit. Okay, kasali lahat dyan sa T. And also for this one, yan, lalong-lalo na kapag ang patient natin is pedia, hindi naman nila alam yung kung paano i-score, di ba? So, we will be using the Wong-Baker Faces Pain Rating Scale. Okay, tingnan nyo na lang yung facial presentation ng patient natin kung alin na dyan yung mukha ng patient natin para maalam natin kung ano na yung score dun sa pain niya. So, we will be using this one sa mga pedia. Okay? Wong-Baker Faces Pain Scale. Wong-Baker Faces Pain Rating Scale. Okay? Kasi sa adult, yung rating scale natin, yung pain scale is mag-rate siya from 0 to 10. Okay? 0 to, is yung mild lang, tapos moderate, and then severe. Okay? Physical examination, this will determine the client's physiologic and behavioral responses to pain. The nurse needs to assess the client's vital signs and also observes the skin color, skin dryness, diaphoresis, facial expression, or the body gestures. Okay? For the physiologic response, this may vary according to whether the pain is acute or chronic. Okay? Acute pain stimulates the sympathetic nervous system, which is ito yung network of nerves that helps the body activate its fight or flight response. Okay, ito yung nag-activate ng ating fight or flight response, our SNS, or the sympathetic nervous system, resulting in increase in, mag-i-increase yung mga vital signs natin, the blood pressure, the pulse rate, the RR, and then the skin color is pallor, diaphoresis, may nagpapawisan sila, and also nagda-dilate yung sa pupil nila, din sa mata natin. Okay, dilatation of the pupil. Okay, next is the chronic pain or the visceral pain. Okay, the parasympathetic stimulation may be observed. Kapag sinabi naman natin parasympathetic stimulation, it relaxes the body after a period of stress or danger. So, after ng ating activation ng SNS, after na nung SNS natin, kapag magre-rest na ito ng ating parasympathetic stimulation. Okay? Ano nangyayari? O syempre, bababa na yung mga vital signs. Decrease in RPL or the pulse rate, lower yung kanyang blood pressure, pupil constriction, okay, magliliit yung size ng pupil sa mata, and also yung sa skin is warm, dry skin. Okay? That is the physiologic responses. Kapag naman affective response, vary according to the situation, degree, and duration of the pain. The nurse needs to explore the client's feeling, like if the patient is feeling anxious, okay, fear, exhaustion, and also depression. People with chronic pain became depressed and also tends to be suicidal lalo pag hindi na nila kaya yung pain. Okay? Behavior responses. The very young, aphasic, and also confused or the disoriented persons often communicate their experience of pain only non-verbally. Okay? We have the facial expression is often the first indication of pain. Kahit hindi yan magsalita. Pero yung mukha niya, hindi na maipinta. Ibig sabihin, in pain ng patient mo. Okay, may nararamdaman siya. Okay, clenched teeth. Okay, tightly shut eye, open somber eyes, lip beating, and also other facial grimace. Immobilization of the body part, hindi niya na ginagalaw yung part na yun kasi pag igalaw niya baka mas lalong sumakit. And also muscle guarding. Okay, yun yung, for example, masakit ang tiyan, ginaguard mo na yung tiyan mo using your two arms. Okay? Rhythmic body movement, this is the rubbing of affected body part. Okay, and also kasali din dyan sa behavior responses ang speech and vocal pitch. This is a rapid speech and elevated pitch, often reflect anxiety, slow pitch, slow speech, and also the monotonous tone can signal intense pain. Okay, so this is sa physical assessment natin, the different responses sa pain. Okay, next one, we have the pain management. For the pain management, it is alleviation of the pain, okay, or the reduction in the pain to a level of comfort that is acceptable to the client. So it includes the two types of nursing intervention. We have the pharmacologic and also the non-pharmacologic. Okay, for the pharmacologic pain management, syempre gagamit tayo dyan ng mga gamot. Kapag sinabi naman natin non-pharmacologic, walang gamot. Ibig sabihin, mga interventions yan. Nursing interventions para ma-relieve dun sa pain, okay? Or ma-lessen yung pain. For the pharmacologic pain management, it involves the use of opioids. Opioids or the narcotics. Kapag non-opioids naman, or the NSAIDs, okay? Adjuvants or also the co-analgesic drugs. So we will be discussing this one dito sa baba. Okay, for the opioids analgesics. It include the opium derivatives. Kapag sinabi natin opium derivatives, this is to treat the persistent or severe pain. Okay? Such as, we have an example here, morphine and also the codeine. Okay? For the non-opioid naman, it includes the NSAIDs, such as the aspirin, acetaminophen, and also the ibuprofen. Pag sinabi kasi nating NSAID, this is a non-steroidal anti-inflammatory drugs. Okay, this is widely used to relieve pain and also reduce inflammation and bring down a high temperature. So, meron siyang effect din na antipyretic, okay? Yun sa nakaka-relieve ng pain, and then yung nagde-decrease siya ng inflammation. Okay? Decrease or inhibit prostaglandins release. Itong ating non-opioids natin. Okay? It controls, pag sinabi kasi nating prostaglandins, it controls the processes such as inflammation and also yung mga formation of blood clot. Okay, next one is the adjuvant analgesics. When we talk about the adjuvant, are medications that develop for uses other than analgesia, but have found to reduce a certain type of chronic pain. And also, these are the drugs with a primary indication other than pain that have analgesic properties. Okay, we have an example here, the mild sedatives or the tranquilizers, diazepam, and also yung mga antidepressant. Okay? So, yung sa adjuvant kasi natin, okay, meron siyang specific na target pero meron siyang effect. Okay, we have primary indication other than pain that have analgesic properties. Okay, we have also the non-pharmacologic pain management. Goal of the physical intervention, okay, mga non-pharmacologic, mga ginagawa yan, mga intervention, for example, nursing management mo for pain, but para ano gagawin mo para ma-reduce yung pain, okay? We have to provide comfort para ma-lessen yung pain, correct the physical dysfunction, alter the physiologic responses, okay? And also reduce fears associated with pain related to the immobility or also the mga activity restriction. So, dapat mawasan yun or matanggalan siya. Okay? We have the cutaneous. Ito pa lang. We have for this one, the cutaneous stimulation. This can provide effective temporary pain relief. It distract the patient or the client and focus attention on the tactile stimuli. Okay, away from the painful sensation, thus reducing the pain perception. Okay. For this one, create the release of endorphins that block the pain stimuli. Pag sinabi kasi nating endorphins, this is the body's natural painkiller. It released by the hypothalamus and also the pituitary gland in response to the pain or stress na nararamdaman ng patient. Okay, next one is they stimulate large diameter A beta cells, A beta sensory nerve fibers, thus decreasing the transmission of pain impulses through the smaller A delta and also the C fibers. Pag sinabi kasi nating A delta sensory nerve fibers, this carry information related to touch. Okay, or sa doon sa sabi natin kanina na tactile stimuli. Okay, and also kapag A delta and C fibers, it carries information related to pain naman. Okay? So, we have an example of the cutaneous stimulation. Number one is massage. We have the effleurage, tapotmen, and also the petrisage. Next is the application of also yung mga heat and cold, yung mga compress, heat and cold compress. Next is the acupressure. Ito yung pressing acupuncture points based on the ancient Chinese healing of acupuncture. Okay? For the contralateral stimulation naman, pag sinabi kasi natin contralateral, pertaining to the other side, kung saan yung masakit yung kabilang side naman ang stimulate. Okay? Stimulating the skin in the area opposite to the painful area. Okay? So that is the cutaneous stimulation. Next is the immobilization. So, immobilizing painful body parts. Ibig sabihin, huwag mong galawin yung part na masakit or stop from moving. Okay? Next is the transcutaneous electric nerve stimulation or the TENS. Okay, same function as the cutaneous stimulation. This is also a method of pain relief, a pain reliever then, involving the use of mild electrical current para ma-relieve dun sa pain na nararamdaman or ma-reduce yung pain. So, meron tayong picture for the TENS here. Ayan. Yung gamit na yan, most ito yung mga ginagamit din ng mga yung mga nagmamassage or yung mga physical therapist natin, meron silang mga ganito na kit na magbibigay ng mga electric currents. Okay? Mild electric currents naman siya. So next one, we have also the goals of the cognitive behavioral interventions. Ano yung mga goal natin? Okay, alter pain perception. Ibig sabihin, yung sa perception kasi na to, how they recognize or paano na ini-interpret yung pain. So, dapat ma-alter yun, okay? Alter also the pain behavior and also provide clients with greater sense of control over the pain para ma-lessen din yung pain na nararamdaman ng mga patient natin. And also, we have the distraction and also the hypnosis. Sa distraction natin, it draws the client's attention away from the pain and lessen the perception of pain. So, di-distract natin sila para hindi sila mag-concentrate dun na parang masakit pa rin, ganun. Okay, so distract natin. We have an example, slow rhythmic breathing. Okay? And also massage and slow rhythmic uh, breathing, active listening, and also the guided imagery. Pag sinabi kasi natin guided imagery, this is a yung mga positive mental image or mga sceneries. Okay? Itong mga to is a example of relaxation technique. Next one is the hypnosis or the hypnotherapy. It is an altered state of consciousness in which an individual's concentration is focused and distraction is minimized. Okay? Change the state of awareness also and it increases the relaxation that allows for improved focus and concentration. So, yun yung ating topic for the comfort about the pain.